Good afternoon, all of you, for those who have made time to join today. So welcome to the launch of our white paper, The Power and Promise of Health Data, Value for Innovation, Quality and Care Efficiency. So this project actually lies under the Digital Health Committee. And within the Digital Health Committee, we have a Health Data and Interoperability Working Group. This was actually one of our flagship kind of projects for this year under this particular working group. And the reason for it is, I think it's well known. I think health data is becoming a very, very important subject as we speak. I think with the advent of digital technologies, digital health data is becoming more and more important. So what does this paper talk about? Of course, we would be hearing from our speakers today, as well as Chris Hardesty, who is the chief author of the paper, on some of the key considerations and recommendations that we make to this paper. But generally speaking, just to articulate the value of health data across the product life cycle from the medtech and healthcare industry, the various sources of data and what value does it bring to patients and to other stakeholders is what we want to talk about. And then this paper is also is just a way for us to capture that information, to do a bit of landscaping, to see what's happening around us, and also give an industry perspective on this. But this is also going to be kind of a tool to get us a foot in the door so that we can then go and start thinking about this with policymakers across the region, and hopefully would be able to make some policy changes towards better health data usage, increased access, health data transfer, security, harmonization, standards, etc. So with that, impetus, this core team together has come up with this white paper, which we are going to be launching today. After the launch, a copy of this would be shared with all of you, and then, as I mentioned, the team would then come together to discuss on how we can activate this paper and make our recommendations and ensure that our recommendations are actually reaching the correct audience, and we're able to shape some policies around this. So with that, we'll start the webinar. Just a few quick housekeeping before we start and I move to the agenda. I would request all of you to remain on mute throughout the session. Please use the chat feature on the tool over here in case you have any questions, any point of view, or any comments that you would like to make during the course of the session. And if you are asking a question, do identify yourself and the company that you represent, and also that the session is being recorded and would be available in the member-only resource at the APACMed website. So in case you want to refer to this session once again, or your colleagues who missed it, you would be able to download the link and share it with your colleagues. So this is how we are structured for today. I'll very shortly pass on to Chris, my colleague, to do the introduction of the paper, share with you some of the key highlights. That would be followed by a presentation on some of the case studies that we have highlighted in the paper by Virginia Chan. She represents Siemens Healthineers, but is also the vice chair of the Interoperability and Health Data Working Group at APACMed. And then we move into the panel discussion, again moderated by Chris. But over here, as you see, we have a fantastic panel represented by various stakeholders, a very diverse group of stakeholders. We have the patients, we have WHO, we have Farhana, who's representing the industry, Dr. Prinja, representing the government, and then and Clive as well from National Health Group. So that's how we have planned. And then Shweta Bhardwaj from Johnson & Johnson, the chair of the working group, would do a wrap up and share with you the next steps. So with that, I would pass on to Chris for the presentation. Thank you.
Great. Many thanks, Anirudh, and to everybody out there for joining today. It's my great honor to be involved in this project and also here to share with you the findings so that we can have further dialogue on this topic ahead. It's overwhelming to see how many people have registered and from such diverse backgrounds and geographies. And so to me, that says there's a lot of opportunity here for discussing the topic, but also it's a great challenge because it is a very difficult and complex topic. So today we'll try and navigate through that. I will do three things for the remainder of this webinar. One is to share more about the methodology that we used for our research. Secondly is to share with you some of the key findings from our research. And then thirdly is to have a discussion about next steps, including from some guest speakers that Anirudh has just mentioned that we'll bring into the conversation a little bit later. And as Anirudh said as well, feel free to interact if you want to put things in the chat, comments or questions. We'll try our best to have a look at those as well. Okay, just to share with you a little bit of the kind of background why we've done this research and how we've done it. Over the last couple of years, APACMed has already laid some foundation for the data topic through the working groups. And so last year we published a couple of papers. One was about real world evidence. And so that was providing some frameworks for regulation and reimbursement of real world evidence in the medical technology industry. And also we started this kind of value of conversation by trying to do a better job of quantifying the value that certain technologies and types of data could provide to health systems. And so we did that through diagnostics last year, and we kind of continued that theme this year. But I think we did find a little bit of a gap in our publications as it pertained to the data aspect in terms of how it's accessed, how it's shared, how it's transferred, because ultimately that is kind of the enabler of a lot of the policies that we're advocating for, especially as we start thinking about moving it toward AI. So that was the impetus for doing this project, and it's really meant to be kind of an educational paper that promotes further dialogue and discussion and advocacy. As you can see, there is our methodology. We did quite an extensive global literature review on this topic, given it is a fairly well discussed topic. So that includes supranational organizations as well as regional, local, and industry reports. But then we did also spend quite a bit of time in the field speaking to different stakeholders, public and private sector alike, and collecting best practice use cases from the medical technology industry. So that is what is included here in the report. And you can see some of our contributors listed there on the right-hand side, who we're very gracious to, and several of whom are here to speak with us today. Okay, so just kind of jumping into the report and the findings and the way that we've structured the paper. Again, I'm really just going to hit the highlights for you, and you can have access to the report yourself a bit later. But these days, healthcare data represents about a third of all data that is generated, so quite substantial. But it's estimated that only about 97% of it is currently harnessed or used as much as it should be. So we set out to just kind of provide a little bit of a layout of the land. With respect to health data, one of the things we do is provide a definition. This comes from empirical sources as well as through discussions with stakeholders. I think one thing we found through our research is there's quite a decent alignment and understanding of what health data means, but in terms of how it's applied in scenarios is where there's a lot of variability, and that's something we can talk about today. We did also in the paper articulate different uses of health data. So one example you see there on the left-hand side is how data becomes basically an intervention across the care continuum, and that's everything from prevention through to diagnosis, treatment, and disease monitoring. So really there's an opportunity for data to play all along the pathway. And here is also how we've broken some of the uses down in our paper that you can check out. So we show how healthcare data can be used better for research, to improve care delivery, and also to actually develop and iterate these innovative technologies. And we give an oncology example in the paper to show kind of end-to-end how data can become this intervention for some of these uses. Also, we talk in the paper about use of data for evidence and for decision-making. And so what we do here is we talk about some major health system ambitions like universal health coverage, but also more emerging ambitions like value-based healthcare, and how data is really a critical kind of asset in order to deliver on these reform ambitions. And so we highlight this in the paper too. And we do a little bit of a tour around the Asia Pacific to talk about what different countries are doing, the good as well as maybe the not so good, just so we can get an understanding of again, kind of the current state. Okay, so that was a little bit about the power of health data. And so then we kind of shift the paper into the promise of health data. And because this is APACMed, we do take a little bit of a focus on the role that the medical technology industry and medical devices can play in the health data conversation. So we give different examples here of specifically as devices become smarter and data stewards, how they can contribute benefit back into health systems. And so we talk about things like using devices and the device data for patient empowerment. We talk about a big trend, which is kind of out of hospital care or remote patient monitoring, and how devices and data enable that scenario. And then we talk about just how data can monitor the devices, right? I mean, the devices themselves are increasingly becoming sources of measuring outcomes and efficiencies and cost effectiveness. So data is definitely a piece of the device strategy there. And also what you'll find is many medical device companies these days do basically offer data and analytics as part of the complete solution too. So that kind of deserves its own line item in terms of the value that health systems can receive from the medical technology industry. That a lot of what I've just said pertains to kind of clinical and access and quality aspects, but we did want to touch on the economic piece of value too. So we've done this kind of implicitly and explicitly in the paper in terms of health economic kind of models, lightly said, in terms of the health data. But one concept we introduced in the paper is the idea of an open data society. This comes from Europe, and it just shows that the larger kind of system-wide effect of being more active on the data strategy. And yes, there's some early investment, but eventually that does pay back dividends to both public and private sector. And in the European example, they estimate they've already created 100,000 jobs as a result of their open data society. So, really this conversation about the promise of data value strikes at the heart of access, quality, and resource optimization. And in our paper, we talk about, the 3 Ps of value, really. So the value that it provides to patients in terms of empowerment, the value that it provides to healthcare providers in terms of better real-time, accurate care provision, and then also the value that it provides to policymakers in terms of being able to really, enable the health reform ambitions that they have, like universal health coverage and value-based healthcare. Of course, not all is rosy and flowery. There are a lot of issues that we need to overcome in order to harness everything that I've just said. I think to myself, on one hand, we are data rich. We've got so many sources of data these days. On the other hand, we're data poor because actually harnessing that data seems to be a tremendous challenge for the medtech industry, but also the wider healthcare ecosystem. And so we frame the issues around 3 major buckets: the access to the data, the sharing of the data, and the transfer of the data. And I won't read through every detail. You have information there and it's in the paper, but just in the access side of things, basically what we're trying to say is because the data is so trapped in different repositories, really we're not maximizing opportunities like real world evidence. So that's why this paper is so important to our other paper, because one is a critical enabler to the other. But even if we overcome the access challenge, we really face a critical issue in interoperability. So that is all these different systems and repositories, including medical devices, and the inability to, through common standards and through common protocols, be able to share the data amongst each other. And I think one important thing for discussion that we found within our research is that people are so frozen by fear of privacy and security that really we're not making as much progress as we need in the sharing aspect, and that's become a huge barrier to progress. The last one there is maybe a little more forward-looking, but something that requires active dialogue, and that is the idea of data transfer. Healthcare knows no national borders, as we saw during COVID-19, right? So, we need to, as we get health systems within countries kind of organized around health data, we also need to be talking about how we share that cross-border. That could be, medical device companies that have their devices planted different places. It could be patients moving across border. It could be data cloud storage. So there's just a lot of aspects to this discussion. And I guess the key point here is to avoid what some countries seem to be doing, and that is overreacting to localization requirements of data, and therefore really restricting this opportunity to have cross-border healthcare that is data empowered. So those are the 3 kind of thematic areas. As you see on the right-hand side, I think where we stand essentially is that we've got this great vision for what healthcare data could be and where all it comes from and how to provide a holistic view of a patient. But the reality is we're just got a lot of loose puzzle pieces that we can't seem to fit together. And that's really the focus of the discussions. I would also say one more thing, which is, yes, there are some technical aspects to figure out with respect to health data, but really, if you think of a lot of the challenges, it is more related to the people side of things, policy, communications, capabilities. So that absolutely has to be the focus in order to make some progress on this topic going forward. Okay, the good thing in our paper is we don't just point out all the issues, but in terms of the power and promise of health data, we also provide a lot of existing things going on that can be better leveraged. And so we do that at, again, kind of like the policy framework level, regionally and internationally. And also we've done this through a case study format by the medtech industry in terms of what different companies are doing and how this could be a best practice for countries in the Asia Pacific to consider. So with that, I will hand it over to Virginia, who is the head of digitalization in Southeast Asia for Siemens. She's going to walk us through some of the kind of best practices here. Virginia, over to you.
Thank you, Chris. So let us move forward to share with you some good best practice that we talk about innovation and quality, but also care efficiency using healthcare data. The first example is from Johnson & Johnson. They've been working with Yale University Open Data Source to allow the scientists from public or private sector to leverage the medtech company's clinical trial data to do the research, and also really have it in a controlled manner to allow data distribution through a fair system. And this is very important that we can support the scientific innovation, but also for the greater public good. And the second example is from Health Catalyst. And this is very interesting example with the Stroke Analytics Accelerator. They've been able to support the regional health system of the emergency department to really look into the first early sign of the patients and also assess the accuracy of the patients for immediate transfer. And this really allowed a very actionable data to provide greater continuity for stroke care. And the results for the quality of care is stunning. The reduction in mortality rate for the stroke patient reduced by 34%, but also the number of stay in the hospital reduced by 20%. That's where we see the value of health data. And last but not least, we also have the example from Siemens Healthineers working with the hospital to provide the hospital data integration platform. This integration platform allows us to have a very precise, but also prevention-oriented data intervention with a longitudinal picture of the patients. And at the end of the day, the hospital is able to manage data as an asset with the digital transformation strategy. If we look into this example in more detail in the next slide, we will see that this hospital data integration platform, first, we are able to integrate the different data from the different repository as Chris has highlighted. And second, we engage with the healthcare professionals so they can use the data. And finally, implement the evidence-based decision-making for diagnostic therapy, but also with remote monitoring. And with all this data together, we are also able to measure and have continuous improvement. And this is really coming back to how can we prevent the disease from happening or deteriorating. And then with this Seoul National University Bundang Hospital, they really face the challenges on how can we move to the value-based healthcare. And the management team's commitment is very important, as we see in these few cases. They are committed to a digital strategy, so they include this integrated data platform and allow AI-enabled, but also evidence-based decision-making for better patient care and preventive plan. And the patient platform and this integrated platform not only confined to the international standards like HR7, where we can share different data, but also it grow over the time to include the clinical, laboratory, financial, medicinal, even genetic or travel, and the personal patient health record. And with this growing integration of the data, we are allowed to do a lot of optimization on the cost and delivery. And the result is also stunning. For the hospital, they are able to improve their top line financially with better resources allocation and optimization by 11 times since they adopt this model. And what we learned, this is also during the COVID time, it allowed the decentralized and remote aspect. And as we see from this three best practice, most importantly here is really the leadership commitment to this data-friendly strategy, including investment in the capability of the people, but also from the technology, so that we really empower the care team to use the data and create the value with the health data. With that, I pass it back to Chris to talk about our recommendation in policy.
Great, thank you, Virginia. So we went down a little bit on the issues and we're working our way back up into a high note here. On the back of learning of the best practices through empirical research and through the field work, we did painstakingly come to some alignment on what we feel like the recommendations from a policy perspective should be. This is just a very high-level graphical snapshot, so you'll find a lot more details in the paper itself. But what we tried to do was correspond the recommendations back to the 3 buckets of issues that we talked about, which is access, sharing, and transfer of the data. And we tried to do this in a way where it's a bit of a stepwise process to policy making in terms of building one kind of brick layer at a time that supports each other. So as you can see here, there's a few areas that we're recommending. And again, I'm not going to read all the details in the essence of time, but one thing is from an access perspective, providing the legal frameworks for how we process data and how we make sure it is open and transparent in a secure way. Because as I said before, one of the issues we face with harnessing the data is just the fact that it's trapped in silos and systems. So here there's some basic steps around just providing more consistent definitions and harmonizing the rules that already exist internationally through frameworks for how different stakeholders can access the data. And we've even just shown a best practice for how to do that, for example. And then we move into like I said, what is really critical at the moment, and that is making sure that the data that exists in the various systems is able to talk to each other so we get a more holistic picture of patients and health systems. And so here we're providing some recommendations on health data minimization, meaning making sure, we're not overdoing it with how much data we're trying to share, but really focusing on kind of the key aspects that are critical for the health system ambition. And then also just making sure there's rules around individual participation and consent in that process, as well as accountability mechanisms. And so we've provided some recommendations around legal frameworks for interoperability and for open source data in terms of just, again, using standards for the protocols that are already available internationally and not sort of unnecessarily creating a lot of variation in that process. And then lastly, like I said, perhaps a little bit more looking forward is just the idea of international health data exchanges. There's already a lot of discussion on this topic. There's an initiative with APACMed in Southeast Asia, for example, to get some common kind of data sharing ecosystem for health systems working. So there's a lot of dialogue happening on the topic. Our main recommendation here for policymakers is really just to engage in the conversation, right? Because if they're not engaged, then probably what's happening is they are creating their own frameworks or, again, trying to hyper-localize the data transfer requirements, which then kind of makes the whole process a lot slower. So we hope as part of APACMed that we can provide a platform for international data transfer, as well as the sharing and access conversation too. And of course, interwoven into all this are recommendations around how we make sure investments and capability development are right-sized for the opportunity at hand, and that there's clear communications. Because one other thing we came across in our research is a lot of different stakeholders just are not always clear on what the strategy is, what the protocol is, what is right and what is wrong. So that all has to be included here. In our report as well, we did provide a kind of maturity roadmap, if you will, which gives countries and health systems an idea of maybe where they're starting and how each of these recommendations enables a different level they can achieve, all the way eventually to really harnessing things like AI once the kind of data structures are in place. So that kind of summarizes there our recommendations, which is probably one of the most important parts of the report and something I'm sure we'll have a lot of dialogue about. Just to basically conclude here, so there's a snapshot of the report cover. There's the QR code to the APACMed website where you can go check out the report. Probably we'll post this webinar recording as well, and lots more information to follow, certainly. There's the contact information of myself and Anirudh, should you like to have more conversation about that. But I think the main point of doing this today is to start the dialogue and hopefully provide a basis for many more conversations to be had. So with that, thank you for your patience. Again, in just a few minutes, not possible to go into all the details of the report, but hopefully you have a better understanding of what we were trying to achieve, what we found, and kind of what next steps could look like. And just on that latter point, really want to bring some other people into the conversation, to share from their perspective the importance of reports like this and how we can action it in real life. For those of you listening out there, again, if you want to put questions or comments in the chat, we're happy to have a look at that as well. But what I'll do is I'll just call on each kind of speaker in turn to share a little bit from their perspective, and then we'll have some cross-stakeholder dialogue before we wrap up today. First, let me call on Aparna from Patients Engage, founder and CEO. She can explain a little more about that, but Aparna has graciously agreed to be the forward of our paper, and I guess would just love to know from you, Aparna, about, what's the conversation with patients as it pertains to health data? Obviously, they're getting more activated, and why do you think papers and dialogue like this are so important from kind of your role in the ecosystem?
Thanks, Chris. First of all, for making sure that the voice of patients is represented. A quick one, Patients Engage is an online platform where we engage with patients living with chronic conditions and their family caregivers, and we've been working on this for almost 10 years now, focused on the Asian ecosystem. I think we are seeing patients are increasingly more and more tech savvy, and they are using a combination of structured data as well as unstructured data, be it in the form of digital files, spreadsheets, messages that they get or reports that they collect on WhatsApp, downloads, etc. And COVID definitely saw a huge impetus in the region on digital health initiatives, which are here to stay, from virtual appointments to wearables to lab reports, etc. I think I think that's why it's important that papers like these or conversations like these happen, because I think we should keep in mind two numbers. One is that in chronic disease management, more than 90% of care happens outside the clinical arena. And that's where you're not going to get data on what's happening with patients and caregivers unless we actively engage and get them involved. And we figure out how they are managing that care outside of the clinical arena. The other number that I would want to highlight is that in Asia Pacific, 40% of the population of APAC is still unconnected. And if you add to that, those who have issues of digital literacy, health literacy, social inequities, we are talking of a significant gap in the data we are looking at. So I think we should keep in mind what it is that will benefit patients in terms of managing their health better. And therefore, we need to bring in patients, understand what they're looking for, and because without getting their engagement, without getting their buy-in, we are not going to get the full picture of, for lack of another phrase, the 360-degree view or the full care continuum that a patient goes through. So I think that's why these conversations are really important. And it's, as you said, that with the increase in conversations around data privacy, we are seeing patients start to wonder about things, and some of them don't have a choice in some areas, but in other areas they're choosing to not opt for certain digital solutions if they think that it may cause a risk to them. So I think again that's an area where more conversations, more education, and ensuring that health and digital literacy go together needs to happen as well in the region. And I think you talked of in the report, you talked of three aspects: access, sharing, and transfer. And I think the current piecemeal approach that's there, or the siloed approach that's there, does not make it easy from a patient perspective. So I think that's something that we do need to recognize, as well as see how to make this easier for. And I'll stop there unless there are any follow-up questions.
Nothing with us, nothing without us, as you like to say from a patient perspective. I think about that phrase often. So thank you for always challenging our thinking and making sure we're rooted in the most important part here, which is the patient. So thank you, Aparna.
Thanks.
Steve, if you're there, Steve is the Director of Data and Analytics for the World Health Organization. And we'll kind of go supranational here. So Steve, you guys do a lot on building frameworks and capability development around this topic. Just like to hear from you on what's going well, but also where you still see some gaps in implementation. Thanks for joining us.
Hi, Chris. Good morning, good afternoon, good evening, everybody. It's my pleasure to be here. So, from a data point of view, from a data point of view, I think we've made and we continue to make progress, and often in things that people don't associate with data. So, let me give you two simple examples. One is the new International Classification of Diseases, ICD-11. That's a really important piece of infrastructure in terms of allowing data to be compiled. So you mentioned earlier, Chris, the challenges of interoperability. Without common definitions and classifications, that really stymies the sharing and the analysis of data. So ICD-11 is a massive step forward compared to ICD-10. So not just in terms of including new disease, but on a whole range of aspects. Another area that's often kind of behind the scenes and people don't think about the importance of it is just the collaboration and coordination across agencies. So WHO works very closely with UNICEF, with the United Nations Statistics Division, with the Population Division, with UNHCR, Office of Drugs and Crime, and of course many academic institutions, all of which is essential for working together to agree on concepts, to agree on how to measure something, and also to agree on the actual estimates themselves, because it's very unhelpful to have several versions of a global estimate, and then users are confused as to, which estimate to use. But that said, there's a lot of gaps, and again, just let me give you one or two examples to begin with. One is CRVS, Civil Registration and Vital Statistics. It's staggering to me. I'm relatively new to the health sector, but it's amazing in this day and age that so many deaths go unregistered every year. Roughly 60% of all estimated deaths around the world go unregistered. So this is before we even try and assess the cause of death, but this is just the event itself. And this stymies so much other work because these are some of the crucial denominators. And births are slightly better, but nevertheless far from acceptable. Other big challenges around data, I think in the coming years, are going to be around mental health and also around well-being. These are two issues that we really haven't challenged or really got to grips with in terms of how to define them and how to measure them from a statistical point of view. Obviously, they're well defined from a medical point of view, but from a measurement point of view, these are enormous challenges. And more broadly, what I would say, and this speaks to your comments earlier, is probably the single biggest challenge from a data point of view is moving beyond what we would call health information systems to information systems for health. What do I mean by that? This is allowing us to measure health in the context of everything else. So at the moment, a lot of health data is quite siloed, and it's very difficult to link it to other social statistics, other demography, other economic statistics, other environmental statistics, which means we can't really look at the determinants or the outcomes fully, because a lot of the determinants and the outcomes of health don't happen in the health sector. And a lot of our data is trapped in the health sector, and so we can't look at the wider picture. Now, why can't we do that? And this again speaks to the points you were making. We have a lot of challenges around access and sharing of data and around data infrastructure. So data infrastructure is things like unique identifiers, common international classifications. A lot of countries haven't adopted them, and they're very slow to adopt unique identifiers, or if they do, they insist on having a unique identifier for the health sector, which is different to a unique identifier for all the other sectors. And that in itself is slightly problematic. And then I'll wrap up by just saying, if we're serious about talking about patient-centric data, then really the big issue that covers almost everything I've mentioned is data governance. And one of the big challenges is not just privacy, but it's more broadly the governance of our data. Who's using it? Why are they using it? How has it been stored? How has it been managed? What are the protocols for allowing access? And just to mention, at the UN recently, well, during the spring, just before the summer, there was a new paper endorsed by the CEB, which is the Chief Executive Board of the UN, on international data governance pathways to progress. And this has set out a proposed roadmap for member states to endorse in terms of how we should look at data governance, because one of the crucial issues is we can't look at this from a national perspective. We have to look at this from a regional or a global perspective if we're talking about sharing data, and especially if we're talking about patient-centric data, because patients are going to move and they want to bring their data with them, and they have to make sure that hospitals and doctors can get access to the data that they need. So let me stop there, Chris. Thanks.
Thank you, Steve. I really appreciate your collaboration and contributions on this report. I think you remind us that we do make progress, so we must remember that too and not be totally negative about it. But I think you've also done a nice job of breaking down what is very an ominous kind of challenge into both things we need to do immediately to improve the situation, but also looking a bit forward into the future as well in terms of inclusivity and new disease paradigms that we need to think about too. So thank you for articulating that. Let me next kind of come into the Asia Pacific region from looking at a health system perspective and kind of health reforms that are happening and how data plays into that picture. So I'll bring Clive into the conversation here, and Clive is with the Integrated Care and Population Health Group of National Healthcare Group in Singapore, just to clarify that. So Clive, would love to know kind of what's the status of health data in Singapore. You guys wrote a pretty foundational paper here as well, and I know you're really passionate about the value-based healthcare topic, so how you kind of see these initiatives playing together. Over to you. Thanks.
Yeah. Thanks, Chris. So I think congrats to APACMed for this very strong publication. It's such an important topic, and it's good that we keep talking about this. Progress can be slow, but I think we got to keep at it. From the provider level, I think that we strongly value the idea of value-based healthcare. We are a bit more able to look at quality indicators now and looking at appropriate care indicators and also PROMs and PREMs. I think now that the electronic health medical records have been in the systems for more than 10 years, data collection is a lot easier. So we do have access to good quality data. But I think that in terms of cost data for Singapore is still challenging because most people associate cost with price, but that's not always the case, right? We are charged a certain price, but there's costs that actually is not built into the pricing because of all the subsidies that we enjoy in the public sector. In terms of using data to look at value, I think that we are starting to do more in this space, but I think that the trust is still building up, right? Because we are starting to use the data to give us insights, value, and then be able to learn from some of the data that is and trends that we see. So from there, we are then able to build this community of learning, and from there build this trust. But I don't think that we have gone on to sharing so well. If I were to just illustrate, in the Singapore healthcare systems, we have hospitals that have been looking at this data for a very long time. Whether or not the data is shared across departments, I think that is still quite variable in different hospitals in the systems. Then we talk about the Singapore public healthcare system where the providers are grouped into 3 clusters, right? So almost like a district health kind of approach. Do the hospitals share data across, with the other providers within the same group? I think that is something that is still developing also. So we are really still, I think many countries are still struggling with the sharing of healthcare data. Back to what Steve said, we can build common standards, agree on certain parameters, but the sharing of it across providers and across data owners still requires a lot of trust to be built up. So I think that just to round off and linking back with what Apna was mentioning, the patients are currently still not really getting a lot of value from the data that they have contributed to the systems. So I hope that in the future we are able to bring in the patient more when we talk about value for the data that we have. So with that, I will stop here. Thank you.
Thank you, Clive, as always, for your contributions as well. And I think one thing that's great about places like Singapore is just how you are forward-looking on topics like these, but into the broader picture, like I mentioned, health reform and value-based healthcare. But as you also said, no one is perfect, right? And of course, Singapore is still perhaps dealing a little bit with some of the leaks that happened a few years ago and just that mentality. One of the quotes I really liked from yours in the paper is, we're kind of building data vaults, not data lakes, and we got to kind of rebound from that a little bit to drive forward. So thank you. Appreciate that. Unfortunately, Dr. Prinja, who is from the National Health Authority in India as part of the Ayushman Bharat Universal Health Coverage Program, formerly the executive director, now doing more kind of academic work. He's been called into a key government meeting, so not able to join today, but he did contribute to the paper. So you can read in the paper about his commentary related to the intertwine of health data and universal health coverage in India. There's some really fantastic and interesting stuff happening there as well. So I won't speak on his behalf, but you can check that out. Last but not least, we have Farhana, who's the SVP and GM of Health Catalyst in the Asia Pacific region. She's helping represent here the APACMed Digital Health Committee. Farhana, you've been listening to the other stakeholders kind of talk about this topic, and we've incorporated a lot of ideas from Health Catalyst in the paper as well. So just curious, what role you think industry and APACMed needs to play, and what people need to do here to kind of activate some of these ideas.
Yeah, no, thanks, Chris, and thanks to the other panelists, and congrats to the team for this white paper. So maybe just to start, just in terms of a bit of a background. So I work for Health Catalyst, and Health Catalyst is a data-driven outcome improvement company. Health data and analytics is all that we do. So, that it's a very big part of, our focus, which is why I was very excited about this white paper. I would say, when you hear everyone's comments, I mean, I'm 100% in agreement. I think we've come a long way in this space. For us as a health analytics company, it ultimately comes down to ROI, right? Unfortunately, and or fortunately for that matter. So when you're talking to governments, when you're talking to hospitals, and you're talking about leveraging data, they ultimately want to know what's in it for me, and how is this going to impact my patients, and how is that going to impact outcomes. And for a company like us that has works with over 500 hospitals globally, that has been the number one thing that we focus on, which is how many patients' lives have we saved as a result of looking at your data or doing analytics. How many lives has it positively impacted? How much, what are the cost savings as a result of this? And I think, as an industry, the more we can come together and share examples of how our solutions, or how med device companies, or how med tech can actually really impact cost, quality, and access, I think we're going to get a lot more interest by governments and other stakeholders in terms of being able to share or look at more platforms. Now, I do think we've come a long way, as I said before, and Steve gave some great examples from WHO. Clive talked about Singapore and their value-based care, and Healthier SG, which is a big focus on population health management and preventative care. All of this requires data. And I think this white paper is just a good example of what we need to do. But, again, even in Singapore right now, there's an initiative called Trust, which is really around looking at a sandbox of healthcare data that a lot of startups and medtech could eventually use. It's de-identified data, and research can be done on it. And I believe just more and more examples like this are really what the entire, Asia Pacific region and the governments need to hear about, because ultimately it does benefit them. I guess the last thing I would mention is, what you talked about, Chris, is I think being able to benchmark to some extent, or tell countries where they are compared to others, is I think something we as an industry can do, because obviously when we talk about med tech and entering markets, those markets that are actually more accessible from a healthcare data perspective, where we can test our solutions, et cetera, or do research, are more attractive. And so if we can go to governments and say, hey, look at you compared to others in the market, or across Asia Pacific, it's something that, you know, at least makes them think about, well, you know, why am I so far behind? And, you know, what am I losing out on as a result of this, right? Because obviously from a market entry perspective, it may be more, you know, it might be more exciting for a company to go to a country that's more open. So I think those would be the key things that I would mention. But again, you know, as I shared from the beginning, I think we've come a long way. And even as a company like us, Health Catalyst, that does nothing but health and analytics, we're seeing more and more opportunity in this market to leverage data to improve health outcomes, which is fantastic. So thanks, Chris, back to you.
Great, thanks. And again, a reminder that no country or stakeholder needs to be starting from scratch here. There's so many great examples to start as a basis. And again, thanks to all of you for your comments. All of you contributed to the paper amongst other stakeholders. So I do appreciate the time everybody makes to see this into fruition. We don't have a ton of time left, and I would love to pick all of your brains more. We'll have to have further dialogue on this topic, obviously, but I think what I might do is try to be democratic about it here. And I'll ask each of you, if you just had to pick one thing, you know, here today, we've talked about some challenges, we've talked about some recommendations, we've talked about how different geographies are doing things, but within the realm that each of you play kind of, you know, in the healthcare ecosystem, where would you start if you just had to pick one thing you would really like us to see us make progress on as APACMed, but also as a kind of wider community here? So Aparna, I'll just go back in the same order. So Aparna.
Sure. Well, I think I'll just say what you said on my behalf, nothing about us without us. So I think the most important is to treat patients as not just beneficiaries of healthcare, but as stakeholders and partners in care, because without patients and their families, we will not have care. So it's important that the industry, the government all start working together with patients and, you know, coming up with solutions that work to everyone's benefit.
And again, thanks for what you do, because it's not always easy to work directly with all patients, but working with groups like yours is really a rewarding experience. So thank you for that.
Thank you.
I think I had Steve next, if I'm not mistaken. So Steve, over to you.
Yeah, thanks, Chris. I think the one thing I would like to do is help governments to understand data as infrastructure. We now live in a data era, and so if I went to a government, for example, and said, look, we need oil or gas, that they understand intuitively that that means we need to put in infrastructure, we need to put in piping, storage, security, cleaning. When we talk about data, they don't intuitively understand that, but we need to put in all of the same infrastructure to allow data to work. And I think a lot of governments still struggle with that. They sort of think that data is free and that you can just glue it together. And so it's helping them to understand it as infrastructure and helping them to understand that good data architecture doesn't happen by accident. It takes deliberative action, and not just for health, but for modern society, for modern economies, they need to take data really, really seriously.
Great, thanks. And we do give a shout out in the paper to all the great training tools that you and your team put together that are available to people too. So recommend everybody to check that out. Thank you.
Thank you.
Clive, what about you?
Yeah, thanks, Chris. I'm very glad to go after Steve, because I think Steve mentioned all the hard infrastructure. I was going to talk about the soft infrastructure, which is actually the people. You know, even if you build the infrastructures and you got all the data sharing standards and all that, if you can't overcome the issue of trust, right? You know, setting the safe space for people to come together to use the data together, you're gonna end up with a lot of data vaults, which is currently what we have. I mean, again, I think we're here to make progress. So, you know, calling it out as it is allows us to acknowledge the problem and then slowly work towards the, you know, unlocking the soft infrastructure of this. Thanks.
Yeah, fortunately or unfortunately, it always seems to be the non-technological stuff that trips us up. So good reminder there. And Farhana, once again, you've had the benefit of hearing from everybody. So what are your kind of final reflections?
Yeah, I could just say ditto, right? But yeah, so I think what I would say is that I would actually go back to what Aparna said. I think let's start with the patient at the center and the outcomes. I believe in everything everyone else has shared as well. Trust is so critical here in the infrastructure, but I think if we can move back to the patient and the benefit to the patient, I think that is always going to win, right? Because at the end of the day, as I said, it comes down to what is in it for me if I'm going to be looking to a government or a stakeholder to share their data, and it's ultimately about their citizens and how it's going to improve and save lives and improve their health outcomes. I think we can't lose that way. So that's my comment.
Well said, and connects the full circle here. I mean, patients can become just another data point in this whole discussion if we're not careful about that. So, all right. Well, thanks to all of you for not only your contributions today, but also, you know, for the paper. And obviously, this is only the start of many more dialogues to be had. But I guess I would just conclude my portion here by saying, you know, if we really want to harness the power and promise of health data, then it is going to take a village. It's going to take public sector, private sector, everybody in between working together. So that's the kind of key here from an APACMed perspective. With that, I will pass it over to Shweta, who, as Anirudh said, is the Johnson & Johnson Global Digital and R&D Policy Director. She's also the APACMed Working Group Chair for Interoperability and Health Data. So some final kind of comments, reflections, next steps from Shweta. Over to you.
Yeah, thanks a lot, Chris. So I think we had heard some great insights today from our esteemed panelists on having, you know, more patient-centric data, of course, importance of health data governance and investment in digital infrastructure or data infrastructure. I think that was point on. And keeping, you know, I really like what Clive said, is keeping trust at the center of these decisions. And of course, and Farhana alluded to, you know, from a medtech industry perspective, you know, what's our role in demonstrating, you know, impact on cost, quality, access, you know, sort of to healthcare more broadly, you know, in these discussions with policymakers. The other point of view is, of course, you know, as you're aware, you know, digital health technology will be and is reshaping, you know, healthcare systems around the world. And we do need policy frameworks which will accept, enable, and value and incentivize sort of these innovations, you know, right from R&D to digital surgery platforms in the medtech industry context. And for this, we must ensure, together with all our stakeholders, that data can be accessed, it's of good quality, can be shared and flow across borders in a very secure way to leverage, you know, our sort of data science and digital health technologies at the end of the day to deliver the best possible outcome for patients. So with this, I would like to thank our esteemed panelists for sharing their thoughts and perspectives with us today. We are deeply grateful for your contribution to the paper. I would also like to thank the core team of the project of the Health Data and Interoperability Committee for their contribution and hard work to really bring the idea of this paper into reality. As a next step, we will be disseminating this paper in select forums and events in APAC during the next quarter. We will also conduct some closed-door roundtables with policymakers and select priority markets in APAC to disseminate this paper, as well as a paper that we had, you know, published earlier on real-world evidence. So if you all have, you know, ideas of disseminating the paper in your countries or markets, please do get in touch with the Secretariat. And last but not the least, thank you very, very much to everyone who joined us today on the call. Hope you found the webinar informative and wish you a great rest of the day. With this, I'll pass it on to Anirudh or Chris. Back to you.
Yeah, I think that's a wrap. So again, thank you all for joining us today. As we all mentioned, the paper would be available to download on our website. So in case you're not able to access the code at the moment, we'll send you the link over email. But again, thank you so much for your time today, and we'll see you again soon. Thank you. Thank you, everyone.